Aloha, welcome to the Sports Medicine Clinic. My name is Dr. Joshua Peiper, and today I am going to demonstrate a self-myofascial release and muscle energy technique for the glute max and piriformis. The glute max, when dysfunctional, becomes weak or inhibited, and to effectively activate and re-strengthen your glute max, you must first remove its inhibiting factors. Quite often, one of those inhibiting factors is a myofascial trigger point within glute max itself. The piriformis, when dysfunctional, becomes short. The sciatic nerve passes directly beneath this muscle and sometimes through this muscle. So when this muscle is excessively short, the piriformis will cause what's called piriformis syndrome, which feels like sciatic or neurological pain that radiates from the low back and hip down the leg to about the knee. To achieve the ischemic compression component of this technique, we are going to locate tender spots or myofascial trigger points and apply direct force into these trigger points for 20 to 30 seconds or until the discomfort becomes less intense. We are going to treat 2 to 3 of these trigger points, which should give us at least 1 to 2 minutes of direct force into the fascia in the area of the glute max and the piriformis. To achieve the self-myofascial release component of this technique, we are going to apply 1 to 2 minutes of direct force into the fascia in the area of the glute max and the piriformis. If we treat 2 to 4 of these trigger points while doing the ischemic compression component of this technique, we'll achieve the myofascial release component of this technique. This technique can be done using a medicine ball or a foam roller. So I'm going to demonstrate the foam roller variation first using a PVC pipe. So I'm going to treat the glute max and piriformis on the left side. So I'm going to lean towards the left side so that I'm kind of sitting on that hip, and then I'm going to take the left leg and cross the ankle or lower leg over the knee, externally rotating the upper leg or femur, which is going to allow me to access some of the deeper muscles within that hip and pelvis area. So I'm going to start closer to the top of the pelvic or hip bone, and I'm going to roll inferior so that I'm rolling towards the legs and feet. As I'm doing that, I'm looking for those tender points or myofascial trigger points, and when I find them, I'm going to stop and pin them down for 20 to 30 seconds or until the discomfort becomes less intense. So I'm going to try to find 2 to 4 of those tender points, if not more, and I'm going to wait for them to become less intense and then continue searching for other ones. So you can also change your angle by how much you rotate towards the PVC pipe or foam roller, or how much you rotate away from it. The closer you rotate towards, so the knee that you're working with towards the floor on the same side as the foam roller, the closer you'll get to that piriformis. So just like the PVC pipe technique, I'm going to use a medicine ball. I'm going to sit on it with just the hip that we're treating. So again, this is the left side. And like the PVC pipe or foam roller technique, I'm going to cross the left leg over the right knee. And I'm going to roll, searching for those tender points or trigger points. And then I'm going to pause when I find them and wait for the discomfort to become less intense. So again, the idea is to find 2 to 4 of those tender points, changing the angle that you're working with, and achieve the myofascial release component by staying in the fascia for about 2 minutes. The muscle energy technique I'm going to demonstrate today is seated. So again, if we are treating the piriformis on the left side, I'm going to take the left leg and cross it over the right knee. So now what I'm going to do is I'm going to lean forward over the base leg or the right leg. And I'm going to lean forward until I can feel a light stretch at the piriformis, which is within that hip on the left side. And when I get to that first barrier, I'm going to hold that position for about 10 seconds. So once that time has passed, I'm going to push the knee down towards the floor for approximately 5 seconds, activating that piriformis. Then I'm going to relax for a second and then lean forward just a little bit further until I find the next barrier, or again, that light stretch. So I'm going to wait at this new barrier for about 10 seconds. And then I'm going to, again, push the left knee down towards the floor for 5 seconds. Then I'm going to relax for about 1 second and then lean just a little bit further forward till I find that next barrier.
again, we want to repeat this process about 4 to 5